Hi, this is Andrew Malekoff. I'm the Executive Director of North Shore Child and Family Guidance Center, and this is Guidance Center Perspectives on Pandemic 2020. And today, my special guest is Dr. Norissa Williams. She's a clinical assistant professor and director of Masters in Counseling programs at NYU. She taught in various university and community settings for the past 10 years on issues of race, ethnicity, culture, and mental health. Her areas of scholarship include cross-cultural differences in mental health help seeking, and she currently teaches courses on cross-cultural counseling and trauma. And I should mention that Dr. Williams has also done training at North Shore Child and Family Guidance Center on many of these issues. So welcome, Dr. Williams.
Thank you. Good to be here.
Glad that you're joining us today. And there's been many credible reports documented from the data that, considering the share of the population that people of color have, that they have died in greater numbers than white people, and that this disproportionate mortality rate is due to underlying health conditions and limited access to quality health care. Can you explain what's going on there?
Yes, I think that what we're seeing is the direct result of systemic racism. So activists and social scientists have been talking about it for years, the degree to which there are inherent barriers within our institutions that prevent Black people and Latinx people overrepresented in those numbers in New York, not necessarily in the rest of the state. But those barriers are what are creating a lot of the disparities and disproportionalities that we see.
Yeah, so our focus today, I should highlight for our viewers, listeners out there, is on health disparities in the pandemic. And so, as you stated, these disparities, racial disparities, are the result of pre-pandemic realities. So can you talk about what systemic or structural racism is about and how its legacy ties into limited access to quality health care?
Mm-hmm. When I think about that, I think about Chimamanda Adichie. A lot of people have seen her TED Talk now on the danger of a single story, and she says, if we start the story with secondly, if we talk first about the Native American and their arrows, and not about the British who came over to colonize, then we don't have a full understanding of the story, and we can dispossess a people. So a lot of the narrative for the past couple of years about Black people and healthcare and different things like that have pointed the finger at them. Well, if they were not lazy, if they were eating better, if they were doing this and so on and so forth, then things would be different. And that's starting the story with secondly, not looking at the history of slavery in the United States and how it has been institutionalized in laws in each of our institutions and our practices and contribute to that. So how it manifests here, how we're seeing it, exposed and laid bare now in the pandemic, is it was inevitable, as well as it's a result of many factors, right? So before we even get into the healthcare system itself, if we think back into slavery days, right? So healthcare was not provided for those who were enslaved for preventive care. It was only provided for emergency care, and that was only so that they can continue to work, right? So it wasn't necessarily even a system that was hospitable to African Americans from the beginning, right? Then we also think about the ways in which the medical establishment have been, hurtful to Black communities, like the Tuskegee Experiment, and then the book Medical Apartheid talks a lot about the ways in which Black people were used at, like the same way that animals are used in testing and different things like that for medicine and different things like that. And we talk about all those things and how they work together to decrease the likelihood of Black people even utilizing services.
Could you
And then
say what? I'm sorry. Could you just say what for those who may not know what the Tuskegee experiment was all about?
Sure. So from 1932 to 1972, so this is a whole 40-year span, researchers partnered with Tuskegee University. They wanted to explore the natural course of syphilis. And so they had about 600 men, 400 of them were, had, what's the word? They had syphilis, but it like latent syphilis, right? And the other 200 were used as a control. These men weren't even told that they had syphilis. They weren't even told that they were in the study to explore the course of it. They were just told that they were going to have free health care while they were in the study, and that their health was being observed throughout the time, right? And so I want to say about 6 months, somewhere during the course of the time, penicillin became available to treat syphilis. This was widely known in the rest of the medical world, and people outside of the study were getting penicillin for their syphilis. The men in the study didn't even know that they had syphilis, far less that there was an option to treat it, but they chose to watch them for a period of 40 years just to see what happens, right? And so not only were their lives impacted, because, you know, syphilis has a lot of correlations with mental illness, you know, and other negative health effects, right? But their children's lives were impacted too, because future generations, the children were born with malformations, so on and so forth. So we're talking like quality of life impacted and all these kinds of things. And it wasn't until the 70s, so a 40-year period, it wasn't until the 70s. So there are a lot of people who are descendants of those who were in the study, as well as there are a lot of people who were witness to. So there's a lot of fear for engaging in the, like, for example, right now when there's talk of taking this vaccine, and Bill and Melinda Gates said that Black people should get it first, the Black community is largely like, oh no, you're not going to experiment on me. And it's rooted in, you know, the larger history of slavery, but also in studies like the Tuskegee Experiment and many others that have, you know, taken advantage of Black people.
So who sponsored the study, this Tuskegee experiment? Who sponsored that? Was that the military, the U.S. government, private industry? Who was behind that?
I know they partnered with Tuskegee, the university itself, but I believe that they were private industry. Don't quote me on that one.
Okay.
But I believe it was private industry.
So you mentioned Bill and Melinda Gates in terms of some vaccination. Can you speak a little bit more about what that's about? That's one that I have not, honestly, I've not heard about that. So I think it would be of great interest to know some of the details.
Mm-hmm. Well, what I can tell you is that I know Bill and Melinda Gates do a lot of work globally with respect to healthcare and different things, and they have been critiqued largely because of the ways in which that they've worked with Black population. For example, they've been critiqued saying that they're, you know, the birth control options that they're making available in these countries, you know, their motivation, their stated motivation is that they want to give women choice and options to be able to plan and choose for their lives. They've been critiqued and saying that this is population control and eugenics at its finest, and trying to reduce the amount of, you know, Black people in the world. And so now later, here with the pandemic, they're invested in, you know, vaccines and making them available. At least that's what they're saying. But they've also been critiqued because when they said that they would give it to Black people first. So what they express is that they're giving it to Black people first because they're the most at risk. But rightly so, the Black community doesn't trust. I mean, I don't even know. I know I'm not getting a vaccine. That is not my intention at all. And then it's largely because I don't trust, you know, because, you know, and that has to do with my beliefs about Western medicine in general. I mean, with respect to certain illnesses that I've had to deal with and how unhelpful Western medicine has been, but other medicine has been helpful for me. But there's rightful fear in the Black community, thinking like, you want to experiment on me, so you want to put me first because you don't care about and you don't value my life. And so, you know, a lot of the Black community is against it.
So even if something is of value and may be beneficial, the legacy of of the systemic racism that you're describing, with Tuskegee Experiment as an example of that. It's left a sense of uncertainty in the minds of many Black folks, and for themselves and their families, as to whether or not, is this real, or is there something else going on here? When you mention Tuskegee, probably most people think about the Tuskegee Airmen, who were heroes in World War II. That's how they're presented. But people are not that aware of the Tuskegee experiment. So I think it was important that you described that, so people understand the context, because context counts. So how do you explain the fact that, in light of what you're describing in terms of your own personal experience and some of the historical circumstances that give a foundation to the things that you're talking about, that there are people who don't believe that systemic or structural racism exists? For example, they believe, well, if I'm, as an individual, I don't believe I'm racist, and it's only individuals that can be racist, how can a whole structure or a whole institution, a medical establishment, an educational system, a housing system, how can that be racist? It's a building, or it's an institution or a structure of some kind. How's that possible?
So I feel I'll answer it in two parts. So how is it possible that it's not seen as a systemic issue? Well, for one, in this country, the ethos of meritocracy, that this is woven into the fabric of our culture. I work hard, so I get it, right? And this just world, I live in a just world. Things are fair for people. And so if I'm good, good things happen to me. And if I'm bad, bad things happen to me, right? So if things are not going your way, then it's your fault, right? And whether or not that is explicit or implicitly said, it is a belief that's held in our culture, as well as we're taught, right, largely in white homes, how we socialize the children about race is that they're taught to look at interpersonal relationships and actions and behaviors, as opposed to systemic behaviors and actions. So we're not taught to be critically consciousness, right? It is more likely to happen in a Black home that you're taught to be critically conscious. Racial socialization happens in Black homes, and it's unique even to African Americans, because outside of the United States, it's not as necessary for one's survival, right? But even our school systems is complicit in teaching to look in individual interactions and not considering how each and every one, our school systems, our medical systems, all those sort of things have laws and practices that advantage one group over the other. So not seeing it also preserves one's own self of rightness or goodness. So Tema Okun, she wrote a book called The Emperor's New Clothes, and it talks about how to talk about race with people who don't want to talk about race. And she talks a lot about white supremacy culture and how it's inherent and absorbed into our institutions and reenacted and maintained, reproduced over and over and over when we don't question it, right? So one of the things that she says is the ways in which white supremacy culture is manifest is this either or thinking, right? And it's a dichotomous thinking. So I'm good or I'm bad. So bad people are racist. I'm not bad. I must be good. I must not be racist, right? And so if I look at it like that, then even if I think of a system, there's so much good to the medical establishment, then I can't see it as bad, and I can't see it as part of the larger problem, right? So just the ways in which we're trained to examine things is largely a part of the problem, and the degree to which we want to look at and deal with how we may be complicit and how we may benefit from racism and those kinds of things would impact the degree to which we're willing to explore and even have our eyes open to see.
Would an example of this be the emphasis on social distancing, which is, obviously something that has been pushed and promoted, and the importance of which is if you're out of reach from the droplets that occur when somebody speaks or coughs, sneezes, yells, whatever it might be, that it's going to certainly decrease the chances of you becoming infected. However, for those people of color who again are disproportionately by share of the population dying as a result of this, some of them, particularly in low-income homes, don't necessarily have the kind of living situation that allows for the social distancing. So this is a message that's being sent to everyone. It's something that that people are taking to heart. Those that are, many are not, but it's something that might not be as easily achievable for certain people, and so it's almost as if that gets factored out of the equation.
I think so, and in addition to that, the earlier thought before mask in in New York, I know more and more people wear masks than in other states, but before that became as and I still see people without masks on a regular basis, but before that became as much a norm as it is now, we weren't thinking about the fact also that not only were Black and Latinx people more likely to live in overcrowded areas, such as apartments and urban areas and different things like that, they were more likely to be essential workers and have jobs because of systemic racism and the barriers that exist with job mobility and accessing education. They were more likely to be out there on the trains and the buses in closer contact with people. So, systemically, that was also a part of the problem. We don't even have to look at the systemic racism within the medical establishment, but all the structures around it that are contributing to this larger problem. And just, really, really thinking about all of those things.
So it must be difficult as you're describing all this, in knowing that the people you teach and that you talk to, like right now, for example, there's people that are saying, oh, that none of this is really true, that it's personal responsibility. Slavery was 400 years ago. Look at where we've come now. There are people of color who are CEOs of organizations, doctors in many of the hospitals, lawyers, teachers, and such. So it's really a question of people taking the personal initiative to get to where they want to be. If there's a health issue, taking the steps in order to to prevent yourself from becoming sick, and and then getting the help that you need to. So you understand that there's a lot of people that just don't buy it.
Yeah, that's disheartening. That's disheartening. And that's what privilege affords you. I don't have to know. It's not necessary for my survival, right? It's a great article that talks about, I can't remember the name of the article, the author at the moment, but she talks about power, right, and stereotyping, right? So those who are in more privileged positions don't necessarily have to know what the life and lived experience of those who are in more disadvantaged experience are. So the nuances of what this day-to-day existence is and what they have to fight are not known, are not appreciated, are not seen, or not factored into the equation. So it might be said, like, okay, well, you're a doctor, and it has been said to me, you have, a PhD, you have been able to rise to leadership positions and different things like that. So then it must, that it must not be as bad as it is. Everyone can do that. Sadly, it's been said to me by a Black person as much as it's been said by a white person. And that's not unusual, right? So oppression is internalized for Black, white, people of color in general in various different ways. So internalizing the dominant cultural narrative, it is, if you believe and not think critically, it's likely that you would say something like that. But what you don't see is what it takes. I've been thinking a lot recently about, I had a student ask me one time when I was teaching about race, culture, and ethnicity. And one thing that has impacted, because we always have to think about our social location, what is my entry point to this conversation, or what it is that I'm thinking about, my race, my gender, my class, all those sort of things that influence how I'm interpreting and what I'm contributing to any given interaction. And so a student, she was a Black woman, asked me if I believed in that as a Black person and as a Black woman, this adage that you have to work twice or three times is hard. And so I said, I was like, well, I know, yeah, definitely, you do have to, work hard. There are systems that are not made for you that you have to navigate around. And I've been thinking about that much more contextually lately in these current times than I have been ever before, because there are many different microaggressive experiences that I, as a Black woman, have had to face. I've had to take, whereas my counterpart, even if I think about in my doctoral program, a white student, there was a straight line for her or for them, a white male, to get to where they wanted to be. For me, I had to go around the block, over, up, down, in, out, and around to end up at the same place and still not be seen as capable. So for example, I even I was at a graduation at the school, so that's not necessarily run into, but as one of my former professors was leaving the cathedral where the graduation was last year, the year before, he asked me what I was doing, and I said, I'm teaching at NYU now. His question was, doing what? What do you mean doing what? I got a PhD. What do you think? Like cleaning toilets, right? So, I mean, that still speaks to how I was seen and how confident people think I am, right? I mean, and you can think about that across various ways too. I'm now in a leadership position at NYU, and both being Black and both being a woman, I can say something and people have pushed back to me, and I'm like, but I'm the director right now. Like, what is going on here? Why is that not respected, right? And so even the way that lives in me, when people have microaggressive and discrimination experiences, that affects all aspects of their lives. There's poor quality sleep. So if for those who are not experiencing discrimination and depression, they're more likely to sleep on average 2 hours more per day, right? And so it might seem like, okay, well, what's a little rest, right? But with rest, it's not just, did you get to sleep good? Do you feel rested? It's restoration, and it's what contributes to regulating your body, bringing down your cortisol levels, releasing melatonin, which helps fights against free radicals in your bodies and all this sort of stuff. So we're at a very different starting point, right? One versus the other when we're talking about health and how we even enter a pandemic. And the starting point during the pandemic, and then how it hits and how it impacts, and whether it's deadly for one versus the other.
Yeah, you did. You mentioned about the propensity for pre-existing conditions. So, diabetes, heart disease, and so forth. And so, some of the reason for that, or the kind of, if people don't like the term microaggression, kind of like the chronic slights that people are getting, all day long, that can wear you down because you can't be defending them all day long. And so it's just something that weighs very heavily, that people really lots of people give no credence to because it's not in their experience.
Yeah, definitely. And it's death by like 1,000 cuts. Like even in right now where we are in our point in history post the death of George Floyd, or I should say the murder of George Floyd, like I feel it in my body. You know what I mean? Like I'm somebody who is well-resourced, and I've been in the mental health field for at least close to 20 years, but I feel the exhaustion in my body. You know what I mean? And having to navigate the world, these race conversations, all of these things, very, 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 I'm aware of the degree to which the cortisol is just coursing through my body. And I think about like how that is impacting my health, like, I think about that on a regular basis, but that's only because I've been exposed to this, like it might not be something that is on, the average person's mind who hasn't been trained in psychology and different things like that. So, it might not be as readily like, okay, I need to stop and take care of myself. That thought might not be there. Whereas the thought might be like, no, I got to keep moving. You know what I mean? Like also recognizing my class and how that affords me the opportunity to still be working from home and, to continue working from home throughout the pandemic and different, just thinking about all the various factors that come into play.
So you mentioned George Floyd, who of course was murdered by the police in Minneapolis, essentially strangled to death with a knee on his neck and two other officers with knees on his back and, on his legs. And so this happening at this point, and it's not an original thought, but, there's been discussion about the fact that there's a second pandemic that we're also experiencing here in America, which is racism. So at the Guidance Center, we work with a diverse group of children, youth, and families. In fact, pretty much the last few years, about half of the population we see is white and half are people, minorities, people of color. And so what should mental health professionals or anyone who works with kids for that matter, what should they be aware of when working with families in this environment that we're in right now? How to be best, to be sensitive to families with respect to the issue of race during, such stressful times with all these kind of monumental, earth-shattering events happening.
Mm-hmm. I think first it's awareness, right? So awareness of, like, even if we're talking about the higher disproportion of Black and Latinx families that have experienced deaths and different things like that with respect to COVID, starting with understanding, like, so this person, if we're talking about a Black or Latinx person sitting in front of me, even if they have not experienced, the loss of an immediate family member or a friend from their inner circle, they're likely to know somebody. Like, so for example, I am grateful that I haven't lost anybody in my immediate family or my inner circle, but I know at least 5 or 6 people, women, who've lost their father, right? Because it's Black men who are largely dying in this, right? As well as I know another 7 to 10 people who've lost aunts, uncles, you know what I mean? Older family members and even friends that are like 30, 40, 50 years old. So even if they didn't lose anybody, being aware of the fact that they may have had people in their lives who have lost, who they may now have to be a resource to and extending themselves. And then also having to deal with, the racial pandemic and what that means for them, because this is traumatic, right? Joy DeGruy has a book that talks about post-traumatic slave syndrome, right? So all the symptoms of trauma, and there she contextualizes it that much further. But if we're talking about PTSD as is described in like the DSM-5, all the symptoms of trauma may be happening, right? So hypervigilance, arousal, sleeplessness, anxiety, depression, all those sorts of things might be happening. They might not be able to articulate it. It might be so much a normal state of their being to get through life that they might not realize that it is at a higher level or out of the normal for them, right? So having this awareness first and foremost, and then inviting all of that into the room. So inviting all of the person into the room, having conversations about the elephant in the room, no matter how uncomfortable it is. And I think that it is, you and I, as well as when I've been at your organization, I have always talked about also, and this is also why I love and admire the work that Guidance Center does, because you understand it from a organizational perspective as well. It's not just, oh, I'm going to have my staff trained or provide. So it is understood that it is an organizational level issue as well. How do you provide a structurally competent organization to be able to do this work? So organizations in general have to also provide an infrastructure and consider the impact of race, right? So that your Black clinicians who are working either cross-racially or with people of the same race, they're experiencing a lot too, and having to experience what they experience and hold space for those that they're serving. White clinicians and other non-Black people of color clinicians that don't necessarily know the experience, but are also vicariously traumatized by all what is going on. What are they feeling? How can they navigate this experience? But also, how can they hold space and understand anti-Blackness as it has existed in America, right? So this interplay between what is it that the practitioner is doing and what are the supports that the organization has for them, right? Considering the extent to which Black people are taxed in having conversations, myself included, having to lead conversations, people coming to you to lead the way. It's a lot of work. And so what might that look like? A reduction in your caseload so that you can get through and manage and be productive, because you are doing so much invisible emotional labor to be able to move the conversation forward with respect to race within the organization. I mean, it's just, there's so much. I'm gonna, when we finish, I'll send you this a guide that talks about anti-Blackness and mental health care, and I'm sure that you'll share it with your, with your staff, as well as with anybody that reaches out to you, to be able to like think about and explore this further, and to think about, how do I institutionalize anti-Blackness and anti-racism in my mental health establishment?
Yeah, so it's really not enough. Like our organization, one of our, it's not the tagline, but it's one of the things that we pride ourselves on, and there's a lot that goes into it, is that we turn no one away for inability to pay.
Mm-hmm.
So some people, right away think that, well, if you use that line, then that means you're good with everybody, Black, white, Hispanic, Latinx, Asian, whoever they are, rich, poor, and so forth. But it has to be more than a throwaway line, that there has to be something that's, integrated within the character of the organization, and that's reinforced on a regular basis. And it doesn't mean that every person is super sensitive and is able to tap into all the historical antecedents of the issues that people are struggling with today, or understand in every moment if there is some kind of a slight that they might be doling out or experiencing, depending who that person might be. But it's really a matter of having an open dialogue, of good communication, to put it very simply, to be a good listener, because you don't have to know everything to be able to listen, but you have to be open to be able to listen and to hear things that you may be unfamiliar with and that you just don't truly get, but you can learn from the people that you work with who have that experience. And I just think that that's so critical.
Mm-hmm. I definitely think it's critical, as well as I think something that you said made me remember the importance of also, like, a lot of people now, a lot of organizations are hiring diversity, equity, and inclusion, or cultural competence consultants to do trainings, right? A lot of organizations made a lot of statements that seemed firm, and then it ends just right there. The thinking about the fact that this is, it's a marathon, right? So today it might look like a training, but what is the work that you're going to continue to do to make sure, don't forget the E, the equity and diversity, equity, inclusion, to make sure that it is an equitable and a fair place, not only for your staff and providers, but also for the clients that you are serving, and to make sure that we're considering those things. And so, and be open to the conversation. Don't tax like the people of color to be able to lead those conversations, because it is so very painful. Bring somebody in, a stakeholder who can speak for them and make it so that it is not as painful to be able to, discuss some of these things, because they're very well part of oppression is being silenced and rendered invisible. And so a lot of that is, there might be a lot of people, you might think that a lot of things are going fine and this organization is good, but even the best of organizations are missing things, right? Are not hearing from people who they might need to hear from. So in considering the conversations and holding that space for dialogue, like you said, consider what's not being said and who's not saying it, and how we can bring that into the conversation as well.
Yeah, on so many levels for a mental health organization, you do have to check a lot of boxes, because there's a lot of regulations and, expectations from your funding source and your licensing source. But at the same time, you have to really consider, well, where's the substance and the longevity? As you said, it's not a sprint, it's a marathon in these kinds of measures that you put in place in an organization. And it can't be perfect, but it's something you can continue to chip away at over a long period of time. So I appreciate your being on the program today, Dr. Williams. This has been Guidance Center perspectives on pandemic 2020 with a special focus on looking at the issues in terms of race and ethnicity, and how that plays into the experiences that people have during this dual pandemic era. So thanks so much for joining us today.
Thanks for having me.